The Cascade autologous platelet system is a self-contained disposable kit with all the necessary components needed for the safe and rapid preparation of autologous platelet-rich plasma and platelet-rich fibrin matrix from a small sample of blood at the patient point of care. Universal precautions must be followed. Remove both yellow PRP tubes from tray. Wipe tops with clean alcohol swab prior to blood draw. Following accepted blood collection guidelines, draw 9 cc's of patient blood into each yellow PRP tube through a non-heparinized line. To maintain vacuum, leave a 1/4-inch gap between yellow stopper and collection tube. Invert tube 7 times to mix anticoagulant with patient blood. Wipe tops with clean alcohol swab. Turn on centrifuge and unlock lid. Place yellow PRP tubes into individual tube holders, placing cap on top, and into centrifuge. Lock the lid. Spin for 6 minutes at 1100 RCF. When using the Drucker centrifuge, push the yellow PRP button. Place tubes opposite each other prior to centrifugation. Use yellow tube counterbalance when necessary. Remove yellow tubes from tube holders. Gently invert yellow PRP tubes 7 times to resuspend platelets. Plasma should appear turbid, indicating resuspension of platelets. Remove transfer device and red PRFM tubes from tray. Assemble transfer device by pushing the ends together using a twisting motion until secure. Wipe tops of yellow PRP tubes and red PRFM tubes with clean alcohol swab. Hold transferred device vertically. Puncture yellow PRP tube and red PRFM tube at the same time and hold until PRP is transferred. Remove the PRP tube and transfer device from PRFM tube. Invert tubes 7 times to mix calcium chloride with PRP. Wipe tops with clean alcohol swab. Place red PRFM tubes into individual tube holders, placing caps on top, and into centrifuge. Lock the lid. Spin for 15 minutes at 1450 RCF. When using the Drucker centrifuge, push the red PRFM button. Place tubes opposite each other prior to centrifugation. Use red tube counterbalance when necessary. Remove stoppers from red PRFM tubes and pour PRFM into sterile field. Tube holders and caps should be cleaned and disinfected after each patient's use according to manufacturer's recommendations. Dispose of all needles, tubes, alcohol swabs, and transfer device into appropriate biohazard container.